but in the last maybe 6 months or so, when Dr. Kevin Murphy and Dr. Kirti and I, when we were talking about this in California, of bringing this to India, uh, because we wanted to make sure that the best service is available in India, and they've been working with us for the last 10 years with significant results. And as you would see throughout the presentation on how effective this particular new service is, my son himself had some concentration issues, right? And and then at that time, when I met Dr. Kevin, he treated him, and the effects were phenomenal, right? And that's what got us going and said, now we got to bring it to India. And Dr. Kevin himself has worked with India for 10 years. He has been here about 15 times to India, and he's very passionate about India. And Dr. Kirti is an Indian born but California resident. And he looks at this as a way of giving back to India for what India has given to him. So this is a very, very personal and very passionate for all of us. And we really thank you for being here. Okay. With that, I'm just going to hand it over to Dr. Sundar.
How's everybody? It's fantastic. Thank you, Pradeep, for a lovely introduction, and thank you, our guests out here, and to Dr. Murphy, who has joined us, Crystal, who's the director of multiple operations in the United States for personalized TMS. So I just wanted to very briefly ask in the audience here as well. I know all of you are absolute prominent media and are helping us to really launch the first footprint of personalized transcranial magnetic stimulation in India. And for me, Chennai is really deeply personal. I did my early schooling here in Kendriya Vidyalaya, IIT Madras in Adyar, and did my med school in India, did my residency in OB, and then subsequently in psychiatry. And just like Pradeep and Kevin have had personal experiences, my mother had postpartum depression and suffered from a lot of problems related to it, which inspired me to look at treatments. And I'm just absolutely thrilled that we had the opportunity to collaborate with Dr. Murphy, who came up with these specific protocols and advancement in administering transcranial magnetic stimulation in a personalized manner with the help of EEG. So we'll just take you through a little presentation. But before I do that, I just wanted to check in with all of you. How many of you do not feel stressed anymore in Chennai? Is there anybody who doesn't have any stress at all? Certainly nobody picked their hands up on this one. So it looks like stress is common, and it is something that you experience on a daily basis. And the personalized TMS is going to be a wonderful experience across human performance. And that is the beauty of it. It helps with wellness, and it also helps with illness across that spectrum. And transcranial magnetic stimulation has been FDA approved. And Dr. Murphy is going to take you through some of the presentations so you'll really understand the importance of this technology being introduced here. And it basically takes us through a very simple outpatient experience without needing hospitalization. And for children, for adults, as well as the elderly, it helps improve common conditions like stress, anxiety, insomnia, and so on and so forth. So just taking you through the problems that we face. As you can see, according to the World Health Organization and from the epidemiological studies, over 50 million folks in India suffer from mental disorders ranging from depression to all sorts of neurodevelopmental problems in children. And this population problem has only risen over a period of time, particularly in childhood. And personalized TMS addresses problems like attention deficit and autism spectrum, which results in a great potential for us to make a larger impact and decrease the disability burden in India. So our goal is to bring with Karma Peak Brain Health personalized TMS by creating a corporate presence and deploying clinical entities across the country to reach a wider population. Of course, our first footprint is Chennai in Temple Towers, and to make this commercially viable, but at the same time, target the underprivileged and work with charitable organization, service the military population in India, and tune up the brain health of the general population, students as well as professionals. And last but not least, also to collect some of the data for research and development so we can continue to advance, because Dr. Murphy and his team have done more than 10 years of research with hundreds of thousands of EEGs and so forth. So in the United States, there are more than 20 plus facilities, including ours, and we take care of patients on a regular basis. So for me, it was important to bring it to India with our team, and we're just absolutely thrilled that we are getting started. So essentially, we look at it that there will be multiple aspects of it as we grow. The first footprint is, of course, the Temple Tower Clinic, but we hope that we will touch upon, as I mentioned, not only serious conditions like depression, anxiety, attention deficit, and PTSD, but also enhancement of human performance amongst professionals and so forth. And again, last but not least, is this elegant historic building, which is where our clinic is located. And you will see on your tables, we have placed a few of our introductory materials. Please have a look at it. It will explain to you what our procedure is and how we plan to introduce it systematically. And we, of course, welcome all of you. We have our first open house, you might call it, or the opening ceremony for it this Saturday, which is tomorrow at 12 noon at the Temple Towers Clinic in Nandanam. So with that said, I'm going to invite Dr. Murphy to take you through some of this presentation. And as they say, Vanakkam.
All right. Well, thank you, Dr. Sunder and Pradeep, for the entire audience who came out to see what we're doing here and adding this into the current therapy regimen for folks in India. As mentioned, I've done quite a few trips here and was really working in the oncology space, where I brought radiotherapy, radiosurgery technology starting back in 2006 to India. I made a lot of trips here, been all over the country, and helping bring those technologies into hospital systems, very big, expensive technologies. When we did that, we were still suffering with some problems with patients following getting brain radiation. And I evolved into a new field of treatment, this idea of TMS, or transcranial magnetic stimulation. And that process is really termed neuromodulation. And so what we're doing is a very elegant way of tuning brain waves. We're essentially finding your brain wave and removing the noise in the system and increasing the signal, which is how well the brain operates and how it talks to each other. So you'll see some examples of that. I'll walk you through that. And then I'll show you a video that really spurred me on, was my own son. And like Pradeep's story, sometimes, we're motivated mostly by our family and our children to try and do better. And that's what got us here. So without Pradeep and his family being involved, we wouldn't be probably here in India. But we're thrilled to be here and talking about this. Yeah, the whole team. But we like to give Noah, I'm not sure if Noah's here, some credit. Exactly, and Crystal too. So the EEG is electroencephalogram. This is what's shown here in the picture. And these are plastic wireless Bluetooth devices that go over the scalp. And underneath each of those pods or circles is a microphone. And it's essentially measuring the brain speed at that location. So in this case, there's 19 different microphones that we're placing on the brain. There's no pain, there's no sensation. It takes about 4 to 5 minutes, and we read the brain frequency under each one of those regions. And that information can be used and then planned for treatment. That device is FDA approved in the United States. When you first do this, you get brain waves. That's where the word brain waves comes from. You see a wave here, or a pattern of sine wave, we say. On the bottom is the sleep state that we go to when we're going very slow. This is our 2, 3, 4 hertz, or 2 or 3, 4 times per second. The brain's firing in the sleep zone, up to about 6 to 7 times per second. Right above that is a area of the brain speed we call in the zone or the alpha state or the meditative state, and that is called the alpha wave. 8 to 12 times per second is how fast your brain fires in that state. That's where you go when you pray, when you meditate, when you're locked in. That's the ideal place to be. We can also have brainwave patterns going too fast. So the ones on top here are going 50 times a second or more. That's an agitated state, a highly alert state. We can go to those waveforms for very brief periods of time, but if we stay at those waveforms, then we have anxiety. If we stay at the lower waveforms, it lends toward depression. In the middle, it creates that just right area. So the zone is where we're going to shoot for. So the brainwave data we take used to be very complicated to read the brain left to right. You see all the waves appearing on the screen, kind of like a seismograph looking at earthquakes, but you have 19 of them, and you're monitoring the waveform. That's too complicated really to do much work with. So our goal was to take that data and mathematically compile it into a pictogram, which I'll show you, and you're essentially taking all the energy from every location and putting it through a mathematical equation or a series of equations that takes that information and summarizes it. So all that data from each location now can be shown in one picture. And this is an example of what it looks like. The front of the brain's in blue, the middle of the brain's in green, and the back of the brain's in orange and red. And we're trying to show you what the brainwave looks like in someone who's perfectly aligned, has meditative state. This is a person who practices meditation. And what you're seeing is that her brain is at 10.2 hertz in every one of her locations. Her frequency is 10.2 when she goes to her best state, and you're seeing the whole brain, in this case, go to that exact same state. That's a highly efficient system. That's what we're looking for when you go to your quiet mind, where there's no distraction or noise. There's a single wave profile from front to back. So when the brain's talking to each other and communicating with each other in the brain, it's on the same frequency. It's clear, it's a clear signal, and that's what we want. We all are here right now in a range of 9 to 12 hertz. So each of us has our own individual frequency, just like all of your vehicles have your own individual RPM at rest. That purring or that at rest idle is what we want to find in your brain. And then we want to copy it and make more neurons go that exact same frequency. So we're tuning the instrument or tuning the system to have a single wave profile like this by giving stimulation. But first you have to analyze the brain, look at what the waveforms look like, and then treat and watch the waveforms change as we treat. So luckily we know that each one of those areas in color corresponds to a brain function. The front of the brain is our thinking and judging and planning areas, and the back of the brain is the visual system. So you can read a lot about how someone's brain's behaving and performing by simply looking at its brain speed. Is it sleeping, or is it going too quickly? Or is it just right? In a traumatized state, if you look at the brain here following concussion, you create this noisy pattern where now the system has developed areas in the front leads which are slowed, more color toward the left of our waveform, and the overall fidelity or the clarity has gone down. This is a noisy system that now has noise in the judging, planning, thinking area. So following concussion, it may be hard to plan, think, or judge very well. There's also noise in the motor planning. So I might be clumsy or have poor balance following my concussion. And the vision system's also off. That's where the concussion happened. The wave is gone completely. That area is even more out of balance. In this case, they're all out of balance. Patients having all the symptoms of the waveforms being disrupted. So our goal is to restore that back to what you see on the far right. And we're going to make a single wave profile and recreate that. So our process is to take the data, it's processed, and then we deliver a protocol to our doctors. And they can be anywhere in the world. They receive that protocol. It's essentially a prescription, and then they can treat their patient with that prescription, which is a protocol for TMS, which is a device on the right you see. So these devices have grown over the years. As Dr. Sunder mentioned, they're FDA approved. You can dial in various frequencies, place the magnetic field in the area of interest, and you can tune the brain in that region. It's painless, takes about 20 minutes a day, 5 days a week is typical. We treat for maybe 30, 40 treatments in most cases. This is a device we brought to India, which is the most modern device, we believe, on the market. And this is in our center in Temple Towers. So I wanted to show that, and then, I think something that, this is our population around the United States where we're located. I just want to mention this has gotten quite a bit of publicity. We've been at the G20 Summit, speaking at their events on this. There's a growing national, international interest in this idea of doing stimulation to the brain. I personally got involved, as mentioned earlier, by treating my own son. I'll play this video for you. This is my son, Jack, about 10 years ago, before treatment and after treatment. He's 9 years old.
Come here. Come here. Come here. Come here. Take some deep breaths. Take some deep breaths. Don't bite me. Take some deep breaths.
So Jack was having lots of symptoms of autism. This is about 6 months following his treatment.
So basically, look, if I would have had autism, Dad would not have started this whole thing. He's going around the world showing pictures of my drawings, like my handwriting. Do you show pictures of my building?
I didn't show your building pictures, I showed your handwriting pictures.
Yeah, I handwrite pictures and tons of other things.
Yeah, sometimes it's hard to explain that unless you see the video of before and after. He became perfect with eye contact, and he really went off the spectrum. He's in college now. Hard to believe this was his handwriting as a 9-year-old. Following therapy, he was writing almost age appropriate. About 9 months following, he was actually at an age appropriate level. So this was what kind of spurred me on to start moving my practice from oncology, treating brain tumors, to start treating the brain. And as Dr. Kirthi Sunder mentioned, we're treating the anatomy of the brain, not necessarily the disorder. So that means a lot of different things are candidates. A lot of persons with a brain, like myself, anyone with a brain really, is a candidate for treatment. And we can tune the system. And when that can remove anxiety, depression, improve your sleep, your focus, and so forth. ADHD is a huge thing. And also, of course, physical head trauma, injury. So, but I wanted to end there and just ask the room if they had any questions to talk about this new technology. And you can ask any of the panel, or while I'm up here, me, anything you have on this. We have a microphone too, if you want to pass it around. Yeah, so the question was, can this treat dyslexia? So dyslexia is where patients have the trouble with flipping words or flipping the order of words as they read or the letters as they read. And yes, I've seen patients with dyslexia problems have improvement when we tune up their front cortex of the brain that manages that. Impulse control problems and anxiety kind of go along with dyslexia, and those are also reduced by our treatment. So I think we don't have a study particularly on dyslexia, but I've had quite a few patients with success with dyslexia. Yep.
How early can we start?
How early in age? Yeah. So I like to start patients as early as we can. I treat 4, 5, 6-year-olds. That's preferable, especially if they're autistic and don't have language. Our goal is to improve the language while their brain's still developing language. If you wait till you finish your language development and start it in the teens, we don't do it as well with those patients in terms of building language. So in autism, ADHD, cerebral palsy, some other injury to the brain, we like starting 4, 5, 6 years old. And it's very tolerable for these kids. They sit in a chair, it looks like a dental chair, and they have a paddle placed over various areas. They don't feel the stimulation. And a lot of kids like it. They'll move the paddle to various areas because it feels like a small vibration on their scalp. So, no. So I've treated patients in like their 90s. I think I like also, as mentioned about getting early treatment for kids, I like seeing us do this earlier in patients with pre-dementia, where they're just starting to have memory difficulties or loss of interest in things, that's the time to intervene. We essentially can move the brain to a faster speed that they had maybe 5-10 years ago. So the computer can look at their EEG, and we can determine where that patient was back when they were 5 to 10 years younger. And we pulse the brain there to see if we can gain more of those neurons going a faster speed. It can be remarkable in some patients that they almost, you put them back 5 years in time. But yeah, so there's really no limit on the upper side of the scale. And there's not a limit between, male, females, kids, adults. So, anybody else on that table? Yeah.
I've seen children going to schools and they record. I've seen a boy going to school and then he recorded and now he's in his college, I hope. So what is the difference that this thing gives? What's the difference between going to school and getting cured and what is the advantage of doing this?
Well, think of behavioral therapy, occupational therapy, school therapies as all being ways to educate the brain and to stimulate the brain in a bit of a passive way, meaning there has to be cooperation. It takes years of sort of practice to kind of train the brain in that way. We're sort of jumping through that and doing a very active treatment. The active treatment actually fixes the brain frequency problem electrically. So it's a quick fix, a quicker fix. You're actually going to move those neurons to an appropriate frequency to do the work. And the beauty is those same kids then go to school and they accelerate because the system is awake and alert and ready to learn. The kid who has very slow wave function has a hard time going to school. It takes more effort to train that child, just like it does if we're half asleep. The brain's essentially half asleep in those kids. And so, like all of us, we're not very good at math and doing our handwriting skills when we're sleeping. And that's what they're facing. Their eyes are open, but the front of the brain that does thinking and judging and planning and handwriting is not awake. And so the goal is to stimulate that area electrically and turn that area up to speed. So it's much more faster and direct.
Anything about the cost? How much will it cost for a session of treatment with children? Just a ballpark.
So on an average, sorry, can you hear me?
Yeah.
So on an average, if it's a 6 weeks protocol, right? So take for example, if somebody has dyslexia or depression, anxiety, right? It's a 6 weeks. Oh yeah. Hello. Yeah. So because this treatment can deal with a lot of different conditions, so there are different varying prices, right? So typically it's a 4 to 6 weeks type of treatment, and that would be roughly about 2.4 lakhs. So somebody is there with a depression or anxiety, they come in, they get treated. But when it comes to autism, it is a longer term treatment because the children have missed several years, so it takes a longer term. So our goal is definitely to work with this population, and we would be doing personalized planning in terms of the pricing model for them, right? Because it's not like a fixed time where we get treat and it'll be done, and we want to work with them in a longer term. Hope that answered, yeah?
Yeah. And in the US, I lived in the US for some time, so I know. Like, does the insurance companies cover this treatment? Like, is there like partial coverage from insurance companies? Or
Yeah.
everything is out of pocket?
Yeah, so the question was about insurance in the United States and major depression disorder and a few other disorders like OCD, obsessive compulsive disorder, and migraine have had approval in the U.S. for insurance coverage. We're doing studies on autism, on PTSD, concussion, and we know it works in a number of other disorders. The way the U.S. and other insurances work is they want to see a study in that particular disease only, or problem only. So it takes time. But despite that, we've grown across the country and we're across the globe now with other locations. I'm going to show you a very complicated picture here for a minute, but it goes to this idea, particularly what we see in our kids. The back of the brain's on the right and the front's on the left. I liken this to two wheels on a bike, and the back of the brain is how we visualize the world. And that's usually not a problem with our kids. They can see, play video games all day long. But the front of the brain is going too slow, and that front wheel cannot keep up with the back wheel. So as they visualize their world, they're not able to think, plan, and judge what they just saw. One area is sleeping. The eyes, of course, are open. So this is where we're going to take that front wheel of the bike and spin it electrically, trying to catch the back wheel. And that's what we're really doing across the whole brain. So that's typical of all of our brains, the front being a bit slower. It's more exacerbated in kids with on the spectrum or ADHD, so forth. Question at that table?
So what is the recovery percentage and the positive side effects?
So I think the question was, are there side effects?
What is the recovery percentage of folks who recover, and then what are the side effects?
So it depends on the disorder. So if I treat, I'd say across the board, all the different kids, adults, male, female, I'd say 80% are going to have a good response. They're going to notice improvement in their sleep, anxiety reduction, and focus improvement. We're essentially making your brain learn how to focus again and becoming meditative. And so it's a large response curve. Most of us could use a tune-up in this room. I need it every 3 or 4 months. It's a reasonable, like 3-4 day approach for me for treatment, about every 3 or 4 months. So it's about 80%, I'd say, have a response, or maybe it's probably a bit higher than that, actually. The durability of the response depends on how the patient treats their brain once they leave. So in other words, are they going to take care of their brain? If they've had injury, are they doing other rehab? Are they medicating or not, and so forth. So it depends on how they manage their brain. I would say the autism kids, they all need a tune-up. They come back in for a little booster every 3, 6, 9 months for a little extra boost to keep the system tuned. Think of it like a piano. Your brain's this big elaborate piano, and it's never getting tuned. We just let it run for years, 50 years in my case, 55 years. And this is sort of the way it is to tune the system periodically, and it plays better. It simply plays better and sounds better when it's a tuned instrument. And that's what we're doing. So across the board. Any questions in the back row, you guys? Our videographers, anybody? No? They're too shy? We've covered the whole thing. Anybody over here? Questions?
Sorry, just one thing I want to add, Kevin.
Yeah, sure.
So addiction, that's another big challenge that we see in several countries, and it's actually increasing now in terms of the drug use or alcohol dependency. So Kevin has had remarkable success with this protocol for treating opioid addiction and other drug addiction.
Yeah.
So can you speak a little bit about
Sure.
that?
Yeah. So again, this is that perfect meditating person with a single file pattern. You see a peak in every one of the areas of the brain. They're all in the same frequency. They're all equal in size and shape. So the brain is very well balanced in situations like this. I'll show you an addiction patient. First of all, there's this COVID brain. COVID really plays a number on our brains and reduces the power. You can see how little energy is present, how it takes weeks to turn this brain back on. It doesn't look like our perfect meditator, but you see a lot more activity as it goes left to right. So in addiction, there's a profile that's very characteristic. On the right, you see that perfect waveform. On the left, this person's having a problem with compulsion and addiction. The first area up here on the very top is attention span. It's flat. So the person's attention span is notably difficult to manage because there's no wave or energy there. The next area below that is impulse control. So there's poor impulse control by definition. So the patient has no opportunity for attention span or impulse control. Those areas aren't even turned on. And then right below that is some frontal anxiety where it's going too quickly. So this is sort of a profile setup for a self-medication problem. These areas right below that are judgment and planning. So if your judgment and planning areas are not tuned up or turned on, it's hard to do judgment and planning. They're essentially asleep. And these kids are also fidgety. Their motor areas are going too fast. So that profile of all those waveforms predicts a likelihood for addictive behavior because it's not working. The brain's broken in a sense, and the kid wants to fix that. So they'll take stimulants to wake up the brain, and they'll take some sedatives to slow the brain down. So both need to be done here, and they'll get whatever they get their hands on to try and fix that. Temporarily, you move the waves left and right by giving them stimulants or suppressants. What we're saying is that there is a wave here. Let's focus on that area and tune the system to their existing wave. And we'll pulse with a magnetic field and try and fill in these gaps and make it look more like the right. And the addictive behavior just goes away in many of our patients because they're not needing to self-medicate. Most of us would want to self-medicate this brain because it's not working very well. So a lot of that's important for your patients because they see their problem areas, and it's a bit of a relief to know why they have their behavior. They oftentimes have a lot of self-loathing and anger, and this sort of says, it's not your fault. Areas that do those functions aren't even turned on. So it'd be very difficult for you to pay attention, not have impulse control problems, etc. So it can be very descriptive that way.
Thank you, Kevin.
Yep.
Yeah. The other aspect is both Kevin and Kevin talked about, right? So this is for everyone. Like I myself has done this like for 60 sessions. I don't have a disorder or diagnosis disorder, but then it's to boost my performance, right? So it's painless. It's I think when you all get a chance, you should come visit the clinic also, and see where you can see the machine yourself, right? Where it's very mild. And it's non-invasive. So that's one of the most beautiful things about that. Thank you. And then one of the things that Kirti talked about earlier is because this is for everyone, not just for the people with some challenges that has been identified. So in the future, we are also going to be opening centers, like a wellness center, if I may, right? So where people could come in just for a day or two type of sessions as well. Kirti, do you want to add anything to that on the wellness model?
Well, first of all, I think I must say Dr. Murphy did an excellent presentation covering it, and Pradeep just mentioning this. So in terms of this spectrum, I think it's so important to recognize that this technology has advanced to such a lovely extent that we are, without any invasive procedure, in an outpatient, comfortable setting, sitting in a comfortable chair, watching TV with music playing, and so forth, you can actually come and get your brain mapping done, as was described, and then you get a pictorial representation of the map of your brain that then we will interpret for you with, Dr. Lakshmi Sanjay's help and so forth. And then our technologists will take you through the steps. And you come in for 20 to 30 minutes a day and essentially come in every day for 4 to 6 weeks. And every week we map your brain and then do assessments to give you an idea of how you're improving. And typically in 1 to 2 weeks, you start to experience improvement. And one of the most important areas in the common, day-to-day life that we lead is the lack of good quality sleep. So sleep is something that is ubiquitously a big problem in our society. And so that starts to improve, focus starts to improve, and overall management of stress gets better. So for those who, especially those who are working in the IT field and who are doing this time zone, if you like, sort of work with different time zones, working with different countries, the sleep is really, really affected. And I think that we would encourage those folks to come along and seek a consultation, a free brain mapping session, and we take them through the process of how it can help improve your performance. So again, as Pradeep mentioned, from children 4 and beyond who experience attention deficit problems to autism spectrum problems, and then moving on to adults with mood disorders, depression, anxiety, sleep problems, head injury, and so forth, to the elderly, postmenopausal, and so forth, who are experiencing problems with sleep, brain fog, and then those conditions such as COVID, as Dr. Murphy mentioned, that has really led to a lot of problem with brain fog, concentration, fatigue, and so forth. They improve a lot. And I think one of the reasons we decided that it was time to come is because A, there's an epidemic of stress and mental health issues across the world, and certainly in India, including alcoholism and other problems. And this is a wonderful, non invasive, non pharmacological, without side effects intervention that I think the time has come for us to embrace it. So, with that, we want to thank you all for attending, and any other summary questions, please feel free to ask us.